I am so excited to present to you our online version of the Neuro-Release Treatment course. In the NRT course, we are going to show you how to use 3 different tools: cupping, instrument-assisted massage, and percussion massage featuring the HyperIce line of products. This is going to give you the ability to treat the entire body and seamlessly integrate between tools so that you can switch tools or combine tools when treating your patients. Pain is a neurologic event, so different sensory inputs are going to work different for different people. We recognize that there's a neurologic effect to manual therapy. By having different tools, I can apply different sensory inputs depending on my patient and what they respond to. There's also a blood flow inflammatory component to manual therapy. Having the ability to provide decompression through the cupping, compression or shearing through the instruments, and then multiplying that with deep pressure percussion and vibration using the HyperIce products, it gives me a lot of options to alter that neuroinflammatory environment that is often related to pain. When we look at our neurologic model, we look at a local, segmental, and a systemic approach. This gives me the ability to treat locally where that pain lives, along that spinal segment, whether that's where the spinal nerve is emerging or along that nerve pathway through the peripheral nervous system, or centrally if I have a systemic or a central sensitization problem, how I might apply those sensory inputs a little differently. We have created this course for online learning. We have filmed it and broken it into chapters so that it's easy for you to digest and review. You can go to the specific lectures, labs, and review segments that you need. For each body area, you will see a lecture, a lab, and then a demonstration. In the lecture, we're going to review the neuroanatomy of the area. We're going to show you where those sensory and peripheral nerves run. We're going to talk about which segments, dermatomes, and myotomes they come from, and then how you may treat along that nerve pathway and some common access points for different pain problems. In the lab section, we're going to draw those nerve pathways. We filmed it from multiple angles so you can see well and get an appreciation for where those nerves run through the body on a live person. We're then going to show you different techniques for each of the tools on how we commonly treat those different body areas. The demo section is just kind of cool. You get to see a highlight reel of different people using the tools in different scenarios. It's fun. It kind of excites you to get ready to use those tools. Finally, we go through administrative things. We're going to talk about billing, ordering supplies, documentation, how to approach your patient, how to describe and get consent for each of the different tools and techniques that we present in the course. And lastly, we do case applications. We go through 14 different cases, things ranging from fibromyalgia to an acute hamstring strain. We want you to be able to treat both chronic problems and acute pain scenarios effectively. We go through those different scenarios, talk about how we would treat locally, segmentally, systemically, and how we may integrate different examples of using those tools for those cases. Our goals for you after this course are to be able to look at pain with a neurologic lens, to be able to appreciate which nerve distribution that pain lives and where along that nerve pathway that pain may be coming from. We want you to be able to apply manual therapy tools to alter that pain input to improve range of motion strength and functional outcomes. We've also created opportunities for support after the course. After completion of the course, you will be admitted into our private discussion forums where other clinicians who have taken the NRT course can ask questions and that will be able to answer from us or other providers. If you have a large group taking the course, you can also reach out about scheduling a private Zoom call after your course to help answer questions that you may have after the course should they arise. This course has been approved for CEUs for several of the rehab professions. Please visit our website for a complete list of CEU pre-approvals. There is a test. You will have to pass the multiple choice test to be awarded those CEUs. Good luck.